Well, so now you're a nurse, and
Yes.
how is life as a nurse in Chicago,
Yeah.
in United States?
Yeah, so I love being a nurse, and especially in this country, because we have a lot of resources that other places don't get to have. One time I took a mission to when I was in the military, I had a mission to go to Chad, and I'm telling you, even the gloves, they're like, you have to reuse those gloves, you have to
God.
wash them, and I tell people here all the time, I'm like, be so grateful that you can have a mask to change.
Yes.
Yeah. So the healthcare system here is, there's a lot to be desired. There's always something to improve, I think. But in perspective of being a nurse, it's a very rewarding career. I feel like it's one of those jobs where we basically say you're never going to lack a job.
Yes.
Because of the many avenues that you can take. So you get a nursing degree, get a registered nursing degree, you sit for your NCLEX, the licensing board, depending on the state you're in, and then you start practicing. So from there, you can work as a bedside nurse.
Yes.
Some people choose not to do that. So when I mean bedside, work in the hospital setting. Some people choose to even do, nowadays people like doing Botox, or giving IV hydration. So, there's so many avenues. Some people choose to be nurse educators. So there's so many avenues. Just with your licensing degree, you can find so many avenues. Some people choose to go back to school and get, I found out that I could actually go back to school and be a health informatics. So I applied to a nursing degree, and I don't even have to take any more classes. I can get a second degree, just dealing with data, the computer side of things. How if patients come to the hospital and just numbers basically.
Yeah, so there's so many opportunities out there.
Yeah, so many opportunities for people to do. So it's a career that is worth it. I always say that we're underpaid. That's one thing I always say. It's an underpaid career for what you do, because it's very mentally, emotionally, all kinds
physically,
physically draining. So you're basically having to deal with families sometimes.
Yes, and even personal life.
Personal life, so when you go to the hospital, you're expected to have this strong faith.
Yes, compassion.
Yes, but maybe you're also going through stuff, so a lot of mental, and I think COVID really brought out the things about mental health in nursing. So a lot of people left bedside nursing because they figured, well, this whole time we're being overworked, or maybe I don't have to go through this.
Yeah, and that's a lot. Yeah.
So I always say, now that I've learned to sometimes say no to working an extra shift.
That's one thing.
Yeah.
Learn to say no.
Yeah, learn to say no. Sometimes telling the patients, maybe I cannot do this for you now. It's not because I don't care, but I'll come back because I need another patient needs to see me. Because we have, in my hospital, sometimes we'll have one nurse will have a ratio of 4 to 5 patients. So that's 5 people depending on you to meet their needs for 12 hours.
Wow.
So so we work I work three shifts, 12 hours. And some people think, oh, it's just 3 shifts per week.
Yeah.
But by the time you're done, you're
exhausted. Yeah.
So I always advocate for take care of yourself on
Yes.
those days, even though you just stay at home.
Yeah, self-love.
Self-love.
It's good.
Yeah, and sometimes people feel guilty, oh, I'm just sitting on the couch and doing nothing.
No,
you
need that.
You
need that.
Yeah, so...
Wow, that's amazing.
Yeah, so I just feel like, I wish, with what I have right now, I just want to share so much with the world. Go back home and learn from the other nurses back home too. I've had friends who have gone on mission trips to Kenya as nurses, and they said it's amazing because the education system in Kenya is different.
Yes,
it's a little
different.
difficult compared to here, I would say. So they have gone there and said, wow, we came back and we learned so much from these nurses back there, the way they handle situations, even with the little resources they have. So the only challenging is the funding back home. Most people are very qualified to go to school, but they don't have the money to go to nursing school. Or the government sometimes maybe doesn't fund these hospitals, a lot of strikes, so there's so many things. What do you think about those kind of things?
I've seen nurses striking.
Yes.
And I just wonder what's happening with the government. And probably they can do something on that.
Yeah, great.